Plant-Based Nutrition Support Group, which is a nonprofit organization dedicated to educating individuals on the benefits of whole food plant-based nutrition in order to reverse their chronic diseases and achieve optimal health. So here at PBNSG, as a member, just a reminder, you have access to a whole team of amazing specialized hosts that each host a monthly meeting. There's an inflammation support group, diabetes support group, heart disease, gut health, cooking for beginners. There's like 12 or 14 different groups at all times. And as a member, you have access to all of those. Just a reminder that you are able to join those at any time. And it's just one more benefit of being a member here. So if you also click on the events tab at the PBNSG website, you will find out when those dates are for all of those meetings. So my name is Sid Notter. I'm a longtime nutrition educator for over 25 years now. I've been teaching whole food plant-based nutrition classes, and I am an author, and I also lead the inflammation support group here on the first Tuesday of every month. You're always welcome to join me there. We have some other events that I'd like to just announce quickly before we get going with tonight's meeting. On Tuesday, February 27th is our member meetup. And then on Thursday, February 29th, leap year, Dr. Kim Scheuer will be here to talk about the myths and controversies about heart health, fats, fish oil, and tips to reduce your cardiovascular risk. Because February is Heart Month, and so it's a good topic to have right then. So before I introduce you to today's special presenters, if you have any questions for the presenters as we go along, please type those in the chat box and we will get to those at the end of the presentation. Be sure to type any questions there. And I'm going to introduce you now to tonight's co-host with me. His name is Anthony Masiello. Hi, Anthony. Tell us a little bit about you before we get started.
Yeah, thank you. My name is Anthony Masiello. I'm a longtime fan of the plant-based nutrition support groups, and I'm happy to be here tonight. I am the co-founder and CEO of a company called Love Life Telehealth, where I have the privilege of both working with some of the most incredible lifestyle medicine physicians who practice who help their patients to prevent and reverse disease or better manage disease with whole food plant-based nutrition and other lifestyle changes. I also have the great privilege of connecting people all over the country and even around the globe with these doctors. And I get to witness the work that the doctors do with the patients and the patients feeling well and going on to live very high quality, happy, healthy lives. So I'm thrilled to be here tonight with to co-host with Sid as we introduce everyone to two of those incredible physicians, Dr. Kiri O'Connor and Dr. Jeff Pierce. And I know you have introductions for them, Sid.
Sure. Well, let me tell you a little bit about those special doctors that are here tonight. Dr. Jeff Pierce is a board-certified family medicine physician who has practiced for over 18 years in Northern California and performed global health work in Africa and Latin America. With a passion for bringing the power of healthy lifestyle habits to his patients, Dr. Pierce believes that patients can achieve just about anything with the right tools. Dr. Pierce attended medical school at the Baylor College of Medicine and completed his residency at the Santa Rosa Family Medicine Residency. He also completed his fellowship in global health leadership at the Contra Costa Regional Medical Center and Massachusetts General Hospital, and he's board certified in lifestyle medicine. He believes that with the right information and motivation, people can get to the root cause of their illnesses and heal themselves. Dr. Kiri O'Connor is also here tonight, and she is a board certified family medicine physician who is also a diplomat of both the American Board of Obesity Medicine and the American Board of Lifestyle Medicine. She's practiced in primary care for over 14 years and currently resides in Ohio. Dr. O'Connor is a graduate of the Kirksville College of Osteopathic Medicine, and she served on active duty in the U.S. Army, where she began to develop her passion for whole food plant-based eating and using lifestyle interventions as treatment options for her patients. Dr. O'Connor completed her residency at Metro Health Hospital in Grand Rapids, Michigan. She was a Leadership and Integrative Healthcare Fellow at Duke University, and she received a certificate in medical nutrition from the Columbia University College of Physicians and Surgeons in New York, and she has her plant-based nutrition certificate from the T. Colin Campbell Center for Nutrition Studies. So welcome and tell us more about your presentation tonight, Doctors O'Connor and Pierce. Thank you for being here.
Well, thank you for having us, and we are going to talk about fatty liver disease.
Very
So
good.
lots to talk about. We've got lots of great information. And Dr. Pierce has recently written an article on fatty liver disease as well too. So he is an excellent expert on this as well.
Wonderful. Well, we have some new people who have joined. I just want to put a reminder that if anyone has questions during the presentation, to please type those in the chat and we will get to those at the end. Thanks so much.
And we have a little, so it's really nice to be here with you folks tonight, and thank you for being here. We have put together a little talk that's going to give an overview with some, I think, important details about what fatty liver is. But this is still an informal talk. We're happy to answer questions, make this a discussion, and thank you for your attention.
Yeah.
All right, I'll jump up the slides. I'm advancing the slides tonight, and I'll just follow your lead on that, Dr. O'Connor, and you guys just let me know when to go next.
Okay, so our topic tonight is on fatty liver disease, and you're wondering what these acronyms MASLD and MASH are. We'll talk about those as we get into this a little bit. There's been a name change for fatty liver disease. Next. We're going to start out defining fatty liver disease, talk about some statistics. We'll cover briefly some functions of the liver. There are 5 main causes of fatty liver disease, but we're going to focus primarily on the metabolic causes. We'll discuss some of the treatment options for fatty liver disease. We are going to focus on GLP-1s a little bit since they are very much in the news today. And then we are going to really emphasize the lifestyle changes as the foundation for treatment. We'll talk a little bit about some things that can impact the fatty liver that are in our diet, like fats, which can increase our triglycerides, sugars, free sugars, and then we'll have a summary slide. Next. So traditionally, it was NAFLD, or non-alcoholic fatty liver disease, which is now metabolic-associated steatotic liver disease. And what was formerly non-alcoholic steatohepatitis is now metabolic-associated steatohepatitis. Next slide. So the guidelines for diagnosis and treatment were updated in about May of 2023, but the name change wasn't until June of 2023. You'll see a couple of different acronyms in here, but generally speaking, for our presentation, I will refer to it as fatty liver disease. Fatty liver disease, otherwise steatosis, is just fatty infiltration of the hepatocytes, the cells of the liver. And you need greater than or equal to 5% of the hepatocytes infiltrated with fat for a diagnosis of fatty liver disease. The most common cause is the metabolic-associated steatotic liver disease. The steatohepatitis is a subset of that, and there's a biopsy that's required for that diagnosis. Most of these conditions are reversible back to a normal liver. However, once you're into the cirrhotic stages, into cirrhosis, cirrhosis itself is not reversible. Next. About 30% of the population is affected. The feature that predicts transplant or mortality is the staging of the fibrosis. It's the leading cause of liver transplants in women and in those over age 65. And it's predicted by 2030, there will be over 80,000 deaths from fatty liver disease. There's no United States Preventative Services Task Force screening guidelines, but it suggested that anybody over 50 or with metabolic syndrome or in anyone you suspect risk, we'll talk a little bit about that in a future slide, should be screened. Next.
So you can see, I'll jump in just real quick, how common this is. You know, if we're talking about 30% of the population affected, and oftentimes when you bring this up at a, cocktail party, which I'm sure we all do, how many people really know what fatty liver disease is, and it's affecting 1 out of 3 of us, and some studies show even higher. So it's pretty amazing how this is in many circles is just kind of going under the radar. And as Kiri's pointed out, it shouldn't be, because it's not just some asymptomatic thing that never causes any problems, but we can see that it's leads to liver transplants. It can lead, or the need for liver transplants, and leads to death and all sorts of really serious stuff that we're going to elaborate on in a sec. So glad that we're talking about it today, because I think it needs to be talked about more.
Great
So can
points,
I
Dr.
ask a
Pierce.
question right here? So
Sure.
when it's 30% population affected, is that for the non-alcoholic disease or 30%?
Right, that's for the metabolic associated. Yeah, yeah.
Okay,
This is for the
okay.
strictly fatty liver. That's not, so that the term non-alcoholic was changed to metabolic associated because there was kind of a negative connotation. There's several reasons for it with non-alcoholic, because there are other causes, not just alcohol or metabolic. There's medication causes. There's some other causes. So this 30%, that's, thank you for clarifying that. That is for the fatty liver, correct?
Okay.
Right. Just associated with, as you'll see, like excess weight, excess fat, and refined carbs in the diet. So that means there's more cases of liver disease out there related to alcohol and other things, but this is just the metabolic associated stuff we're talking about.
And it's probably underscreened and underreported.
Mm.
Okay, next slide. So here's a picture of the liver. The only thing I really wanted to point out here was the portal vein, which is kind of the purple one that comes up from the bottom of the screen. The reason that's important is there's something called first pass metabolism. So anything that we ingest and it goes to the GI tract gets first metabolized through the liver. The liver is one of our organs of detoxification in the body. So a lot of what we do consume will directly impact the liver. Next slide. Okay, next slide. Here's just some brief functions. Again, detoxification organ. It stores glycogen with help from the pancreas and glucagon. It can help produce, release glucose from the glycogen storage when we need it. Liver produces bile, which aids in digestion. It helps produce plasma. It breaks down something called TPA. TPA breaks down clots in our body. Next slide.
And while we don't have to know, I guess, every step of this that Kiri was just mentioning, it, this is just as a reminder how this liver is so important for us day in and day out, from morning to night, in so many, I mean, minute to minute, we're dependent on it. So we need to treat it right.
And the next slide here gives an idea. It's a busy slide, but it gives an idea of all the things that the liver does for us. This is not inclusive. But it's a pretty good idea of all the different functions that the liver does in order to help support our lives. Next slide. So the 5 main causes here are alcohol, the metabolic, which we're going to focus on. There's medications. And it's interesting that the medications are broken up into 2 different types of categories. There's a category that actually creates liver injury by more fibrosis and less fatty accumulation. And those are things like amiodarone and methotrexate. But there's also several groups of medications that they're not sure if it's liver injury or if it's secondary to weight gain from the medications. And that would be things like corticosteroids, antidepressants, things of that nature. Genotype 3 of hepatitis C can lead to fatty liver, as well as some rare genetic syndromes. But again, we're going to focus on the metabolic aspect. Next. This is a very busy slide. Just wanted to give you sort of a 30,000-foot view of what medications can impact the liver. So there's quite a few at different steps along the way. Next. So fatty liver disease, it's a diagnosis of exclusion. Again, there's no United States Preventative Services Task Force screening guidelines. Fatty liver can be seen on ultrasound imaging. For steatohepatitis, you'll need a biopsy plus one of the following 5 for diagnosis. And these 5 criteria very closely mirror those that we would use to diagnose somebody with metabolic syndrome. So looking at elevated triglycerides, low HDL, elevated glucose, insulin resistance, impaired fasting glucose, elevated blood pressure, and BMI. For metabolic syndrome, instead of BMI, they use waist circumference, but for this, they use BMI. There's 2 enzymes produced by the liver, ALT and AST. Typically in fatty liver, ALT will be elevated. AST itself is not specific to the liver, but both can be normal. And the deceiving thing about this is they can be normal in very advanced and severely diseased, like cirrhotic livers. So it's important if you're concerned or you're worried or somebody meets some of these criteria to really get a liver ultrasound and to follow that up.
And I know we're using a lot of abbreviations here tonight with you. And just to clarify a couple of things, HDL that's the good cholesterol that oftentimes your doc's like, oh, you need to have more of this kind of cholesterol, is kind of something you might hear your primary doc talking about. Triglycerides, another result of the cholesterol panel that you'll get. And that A1C is that 3-month average of your average sugar level in your blood, your average glucose level in your blood. And this ALT and AST that Carrie just mentioned are pretty common tests that your doc might even be getting, or your otherwise healthcare provider might be getting on your annual or every couple of year blood test. And it can be a reflection of liver damage, but like she just mentioned, you can have totally normal levels of these tests, even if you have fatty liver disease. And that's one of the reasons why there's not a great screening test, because some of these tests look normal and you might already have the disease.
Next slide. Thank you, Dr. Pierce. Screening for fibrosis. Any patient that's obese or with metabolic complications, including things like type 2 diabetes, moderate alcohol use, or family history, you want to screen for fibrosis. It's stage 0 to 4. 4 is the most severe. There is something called a FIB-4 score. It was originally created for patients with HIV. However, they did find it was beneficial for patients in fatty liver. If you're under age 35, it's not very specific. If there's a score of 1.3 or less, there's about a 90% certainty that you can rule out advanced fibrosis, but you want to get a repeat of that FIB score in 4 years. The FIB score uses age, platelet number, your ALT and AST, the 2 liver enzymes that we just talked about. If your score is 2.67 or greater, most likely there's advanced fibrosis. If you have an intermediate score, there's a suggestion that a patient obtain something called a fibroscan to look for liver stiffness. Next slide. There's no real approved medications, but lifestyle really is the cornerstone. And I know Dr. Pierce has a lot of experience with the lifestyle changes here for fatty liver.
No more than, and probably less than Dr. O'Connor, to be honest, but that's really going to be the focus of what we're talking about, is what can we do to prevent this and to even treat it if it's present. And the good news is that it's not an expensive injection or a liver transplant for everybody and their neighbor. It's really just getting to the root cause of what brought this about. Well, if you get to the root cause about it, we can reverse it oftentimes, and of course prevent it. If you think of 4 main categories of how lifestyle can address this, one is choosing the right diet. And like you've heard before, luckily there's not the best diet for heart disease, and then some other best diet for diabetes, and then a third best diet for prevention and treatment of fatty liver disease. It turns out that it's all the same diet, which is a whole food plant-based diet. And for many reasons that we're going to get into a little bit more during the talk this evening, but a whole food plant-based diet avoids a lot of the foods that can cause injury to the liver, like high saturated fat foods that are often seen in animal products, and then brings in all this great nutrition, the antioxidants that plant foods are just so rich in, and that are basically non-existent in animal products. And so if choosing the right diet, a whole food plant-based diet is one of the 4 sort of cornerstones of treatment and prevention for fatty liver. Then another is, I'm going to skip around a little bit, but I also think about weight loss. Even 3 to 5% is starting things really in the right direction. Upwards of closer to 10% of your weight loss can reverse these changes that would show up on a liver biopsy, for example. And we know that weight loss isn't necessarily an easy thing, but working with a lifestyle medicine practitioner will help you go in that direction. And then the two other areas that we're going to talk more about are exercise, which is not just a way to lose weight and see the benefit that we were just talking about weight loss, but it just has additional effects on having the liver have less fat deposits in it. And then the last is choosing not just what you eat, but when you eat it. So it turns out that if we can have a break of 12, 14, even 16 hours from our last meal in the evening to our first meal in the morning, then these sorts of eating timed patterns can help with reversing fatty liver as well. And these are all things that have been shown in studies.
Yeah, and eating your calories earlier in the day can make a big difference as well too. Eating your calories later at night, you're going to store more as fat. So that can really have an untoward effect. Ketogenic diets can not only contribute to fatty liver disease, but they can definitely worsen fatty liver disease because they're so high in fat. Next slide, please. So things you want to do for treatment as well too, you want to control hypertension, hyperlipidemia, type 2 diabetes. You can use statins. Rosuvastatin is considered one of the better ones because there's less hepatic metabolism. But you don't want to use it if you strictly have fatty liver disease. You want to use it if there's like high cholesterol, hyperlipidemia, and fatty liver disease. You can use statins with fatty liver, but you don't want to use them in advanced disease. And again, not to be used as a solo, as a treatment for a solo diagnosis of fatty liver disease. You can use it if there's a combination with another indication for the statin. There's a couple of other medications you want to avoid as well. Next slide. Bariatric surgery in one study was found to reverse non-alcoholic steatohepatitis, or now metabolic associated steatohepatitis, in 85% of patients. There's some other things that have shown potential benefit. Vitamin E is one, but you want to avoid that if you've had prostate cancer or a family history of, or if you have diabetes. The GLP-1s, we'll focus on that in the next couple of slides. But again, the cornerstone is lifestyle changes, as Dr. Pierce talked about. Next slide. So GLP-1 is glucagon-like peptide 1. It's a receptor that's in the upper brain and in the GI tract, and the body thinks there's enough glucagon. So insulin keeps working unchecked. Insulin and glucagon from the pancreas both, one is from the beta cells, one is from the alpha cells. They work in concert with one another. And when the body thinks there's enough glucagon, insulin keeps working unchecked, so it can lead to hypoglycemia. That's one of the risks. It can impact body weight. Definitely, there's plenty of studies that have shown people are losing, up to 10 to 15% of their body weight over a year. I've seen studies anywhere from 40 to 68 weeks. It can also have a clinical, biochemical, and histologic markers of fatty liver and fibrosis. There can be some improvement with fatty liver disease. It does change appetite in the hypothalamus. It downregulates appetite. But one of the things it does too is it slows gastric outflow. And this is a condition that's common in people who have diabetes, whether or not they're on GLP-1s, is they can have slowed gastric output, which is a condition called gastroparesis, which can lead potentially to bowel obstructions. The weight that's lost, there's some concern. About 20 to 30% of the weight that's lost is fat-free mass. That means you're losing lean body mass, you're losing muscle mass. And once the medications are stopped, there's the rapid regain of weight. And there's a question about how much of that is fat mass that's being regained versus lean body mass. Next slide. There is a black box warning on these medications for thyroid cancer or multiple endocrine neoplasia. Here's some other side effects, like mood changes, potentially diarrhea, worsening diabetic retinopathy. There is some discussions, although I have not seen any studies or anything in print, that there could potentially be some malnutrition, or they're not sure if the body itself, once you're on these medications, downregulates the GLP-1 receptors. So that's to be determined. Also, if you're going in for a colonoscopy or EGD, the American Society of Anesthesiologists recommends you stop these medications either a day or a week before, depending upon the preparation you're on, because they have found the patients are at risk for aspiration. There's a tech company out there right now, actually, that are looking at the origins of hungry, a hungry gut versus a hungry brain, and where it would be better to use these GLP-1s. Next slide. So as an example, if you are paying cash out of pocket for, say, Wegovy, it's about $1,300 a month, and you have no insurance coverage, or your employer is not covering it. If you had $1,300, here's potentially what you could do with that. You know, seeing a dietitian weekly for a month, your groceries for a month, a gym membership, and then, you know, that great vacation where you could show off your weight loss using a whole food plant-based diet. It's about the same cost of Wegovy. It's pretty expensive, and more people I'm reading about are not covering the cost. So it would be determined, you know, what's going to happen with this in the future. I don't know, Dr. Pierce, what you've seen, or
As far as coverage
Yeah,
from insurance, I'm not sure. Yeah.
Okay. Next slide. Again, the cornerstone is lifestyle changes, and it's not just one thing, it's a synergy of all six. It's the dietary intake, it's the exercise, it's lowering stress levels, lowering your cortisol levels, avoiding toxins, getting enough sleep, and being connected. So it's not just one thing, it's the cornerstone of all six, but certainly diet and exercise are the foundation. Next slide, please. So there were a couple of studies that were done that were highlighted by Physicians Committee for Responsible Medicine, and they found those who ate the most vitamin A in the form of carotenoids from plant foods like legumes, grains, fruits, and vegetables were the least likely to have non-alcoholic fatty liver disease, or what is now metabolic associated steatotic liver disease or fatty liver disease. Also, foods like red and processed meat increase the risk of fatty liver disease. And in the NHANES study from 2005 to 2010, they found that adherence to a healthful plant-based diet was protective against fatty liver disease. Next slide. Again, the foundation, whole food plant-based eating, we want to increase your fiber intake at least 35 grams a day, if not more. The countries with the highest fiber intakes have the lowest rates of colon cancer. That's well documented. Types of fiber are soluble and insoluble. Some foods like apples have both. The soluble fiber will form a gel, which kind of slows the transit time in your GI tract. It traps fats, it stabilizes blood sugar, will lower cholesterol, and insoluble forms are prebiotics and probiotics. These are really necessary for our gut microbiome and to prevent dysbiosis. So the prebiotic is fiber that's not digestible by us, but are digestible by the gut bacteria. And the probiotic are fermented foods, you know, things like kimchi, sauerkraut, kombucha, natto, which is fermented soybeans. Prebiotic foods, oats, some grains, some beans, different foods, again, have both properties. And then some of the soluble, a lot of fruits, citrus fruits especially. And I learned something in this presentation. I did not know that kiwi was considered a citrus fruit and that you can eat the peel. So, so eat more kiwi.
Yeah, and I like how Dr. O'Connor breaks it down, and my guess also, you know, this is really cool for education to see how fibers are helpful in multiple ways. And the good news is, unless you're studying for the test tomorrow, the easy thing to do is just eat plant foods, a wide variety of them, and you're going to get a great mixture of all sorts of fibers. So no need to write down the individual foods, but we're just giving you an idea of how some contain more than other types of foods. But if you just eat a wide variety of plant-based foods, you're set.
And eat the rainbow, you want at least 30 different plant foods in a week in your diet. And spices count, actually, nuts, seeds, and spices. Next slide, please. So we want to lower our saturated fat consumption. There was a study that was done where they gave participants saturated fat, sugar, or unsaturated fats. The saturated fats raised the triglycerides by 55%. The sugar raised triglycerides by 33%, so both are bad, but the triglycerides are directly linked to fatty liver disease. Increased saturated fat consumption, excuse me, is also a risk for heart disease and type 2 diabetes. We want to eliminate high and ultra processed foods, including the vegan junk foods. They're no better than any other high or ultra processed foods. You want to limit and avoid liquid calories. You want to eat the orange, don't drink the juice. When you blend up juice, or you put an orange, I'm sorry, when you blend up like oranges in a blender, or you put the orange through a juicer, you're getting all those free sugars that are being released from the cell walls, which can dramatically increase your blood sugar, and it can also increase your triglycerides and increase your caloric intake, because it's much easier to drink a glass of orange juice that may have 4 or 5 oranges in it than it is to sit down and eat 4 or 5 oranges. You want to avoid trans fats. They're found in meat and dairy, partially hydrogenated oils, and in ultra-processed foods. The tricky thing about trans fats is that if a product has 0.5 grams of trans fat or less per serving in the United States, it can be listed as 0 trans fat on the package. Trans fats are directly linked to heart disease. Work on increasing omega-3s, walnuts, lentils, chia seeds, flax seeds. They can help lower triglycerides. Avoid artificial sweeteners, and we want to keep the triglyceride level less than 150. And we'll have a couple more notes on artificial sweeteners and triglycerides coming up in the next slide. Next, please. So most of our body's fat is stored as triglyceride. It's the most common type of fat in the body. It's released from the body in the form of fatty acids. It can help create heat and energy and fuels movement when it's needed. Dietary sources include alcohol, oils, butter, excess caloric intake, again, sugar, refined carbohydrates, which is the simple sugars. And then intrahepatic triglycerides are a marker of fatty liver disease. There was a study done looking at triglyceride levels, blood glucose, and A1C, and triglycerides were the part studied that was most closely associated with fatty liver disease. Next slide, please. Elevated, again, triglycerides, we know fatty liver disease, but also coronary artery disease, myocardial infarction, peripheral arterial disease, stroke, metabolic syndrome. But there's some other non-dietary causes as well, too. Inflammatory conditions like rheumatoid arthritis, thyroid disease, smoking, lack of physical activity, certain medications, and then certain liver and kidney conditions. If you have a risk factor, definitely get your triglycerides checked if they're above 150, but things like family history, pregnancy, menopause, lipid metabolism disorders, some ethnicity, South Asian ancestry. Next slide, please. A note about free and added sugars. So our brain requires monosaccharides for energy. I've read that we need about 500 kilocalories or 500 calories of glucose a day for our brain to function. That's the primary fuel source for our brain. It's not fats and it's not protein. But excess sugar can lead to cognitive impairment and increase our risk of dementia. When fats were associated with cardiovascular disease, they started putting added sugars in our food stream, and the consumption of refined carbohydrates increased. And this is where we believe that's where it's gotten us to where we're at today. Over 70% of foods in the US grocery stores contain added sugars. So you're getting a lot more than you know. Sometimes I'll tell patients, like, stand in the ketchup aisle or the ketchup section and try and find a ketchup without sugar, or same with pasta sauce. Like looking in the aisles and trying to find a jar without sugar. It's really hard to do. The main dietary source today is still sugar sweetened beverages. The Framingham study, which was begun in 1948, still going on today. They have found that frequent consumers of sugar sweetened beverages had significantly increased liver fat, dysbiosis, which is your gut microbiome, decreased HDL, which is your good cholesterol, increased triglycerides, which we just talked about being directly linked to fatty liver disease, and cholesterol levels. There's been a 42%, or there was, I don't know what the stat is now, I couldn't find it, but 42% increase in 30 years from 1970 to 2000 in the use of high fructose corn syrup. And some, free sugars again are in dried fruits. Be really careful with dried fruits, and then blended fruits. Next slide, please. There are some artificial sweeteners that are linked to obesity. They can increase your triglycerides, like sucralose. Sucralose is a non-nutritive sweetener along with saccharin that can lead to dysbiosis of the gut microbiome. There's some evidence that a nutritive sweetener, stevia, which is found from plants, can as well. And they can also lead to increased caloric intake. I found this interesting. The American Heart Association and the World Health Organization would recommend no more than 10% of total calories being added sugars. That's approximately 12 teaspoons a day. And the NHS in the UK recommends no more than 5%. So that would be about 6 teaspoons per day. Currently in the US, the average intake is 17 teaspoons of added sugar. That's already on top of natural sugars that are in foods. That's a lot of sugar. And there's well over 60 different names for sugar. Next slide. So I won't read through these, but this just gives you an idea. There's a lot. And there's some of these names that you think, well, how is that a sugar, right? You read it and it doesn't seem to indicate sugar, but it's sugar. It's all processed the same. Next slide, please. Again, a little note on dysbiosis. Sugar alone has been associated with profound dysbiosis of the gut microbiome, and alterations are similar to those observed in neurodegeneration. Again, think of cognitive decline, dementia. Next slide. So brief summary, again, whole food plant-based eating. You want to increase your fiber intake, at least 35 grams a day, if not more. Avoid high and ultra processed foods, refined carbohydrates. Leave the cookies, candies, cakes, and donuts behind. Limit your saturated fat intake. Now, plants do have saturated fats, but it's usually what they need for themselves. But it's much, much lower than what we get from processed or animal products. You have to move. If you have a BMI greater than or equal to 25, definitely look at weight loss. Time-restricted eating, intermittent fasting. Avoid toxins. Get checked if you think you're at risk or a family member is at risk. Improve your sleep, stress, and connections. Next slide. And here's a couple of fun pearls I thought I would throw in. So a lot of people think, well, I'm going to start this and in 21 days I'll have a habit. There's a myth of the 21 days. The 21 days came from a book, actually a plastic surgeon had written in the 1960s, stating that that was the average number of days it took people to adjust to their new noses. So it takes a lot longer than 21 days to form a habit. So it's the day-to-day consistency that will get you, to the success and help you with the progress. Taste buds, if there's something that you don't like, just hang on, your taste buds will change. As we get older, foods taste less strong. They're much stronger when we're younger. So just keep trying things and keep trying things in different ways until you find a way that you like it. And then if you are thinking supplement versus food, Dr. Greger has some great information on nutritionfacts.org on this. Eat the food, not the supplement. Supplements are unregulated in the US, and curcumin, while it shows great benefits, it's better to eat the turmeric root because you're getting the whole food versus the curcumin supplement, which is just one component of that entire food. Next slide. So thank you very much. And we'd be happy to have a discussion and take questions.
All right. If there are any questions from anybody watching, please type those in the chat. I have a few of my own just in case no one else has any. I don't see any in the chat right now. Do you, Anthony?
No, I have one if it's okay. So you mentioned fibrosis over and over, and I understand that that's when the liver becomes damaged, but can you just elaborate a little bit on what actually is happening when there's fibrosis begins in the liver and why that's such a concern?
Good question. Thank you. It's when the hepatocytes, the liver cells themselves, are dying and scarring. And once that happens, there is some indication with some medications like the GLP-1s or with diet and exercise, there can be some early reversal. But once that process starts, it's more often than not irreversible. Dr.
Thank
Pierce?
you. So then does that kind of mean then that part of your liver is no longer working for you or helping?
Correct.
Okay.
That part of the liver dies. Correct. Right.
Wow. Thank you.
All right. So I have a couple questions. So I know you said earlier that sometimes the blood test can be normal, yet you will still have liver disease. What would be some of the symptoms of liver disease? And is a blood test usually the way it's first diagnosed?
You can see, we look at the AST and the ALT if it's 2 to 3 times normal. That's usually an indication that something's wrong and it needs follow-up. There's some other tests that can be done to say, is this coming from the liver? Is it coming from bone? Is there some other process? If they're slightly elevated, you want to watch it and repeat them. If they're definitely elevated, you want to investigate a little bit further. But if somebody does meet those criteria of, having a BMI greater than 25, has, metabolic syndrome, insulin resistance, diabetes, high cholesterol, you may want to consider a liver ultrasound. Oftentimes I will send patients for a liver ultrasound, and that's when it's found. And we'll start working more aggressively on lifestyle changes. I have not had patients that have come to me, very symptomatic and said, oh, I think I have fatty liver. Again, it's typically a diagnosis of exclusion. There are some liver diseases that have some very specific symptoms associated with them, but I have not seen specific ones in my patients with, early fatty liver disease. I don't know, Dr. Pierce, have you?
Yeah, when I was researching for the recent article I wrote, I was surprised when I read that some people, and it's definitely a big a minority, might have a little bit of fatigue, so some tiredness, a little bit of a belly fullness, or even some itching. That was a surprise to me because everyone in my clinical practice that has been diagnosed with it, at least it was just kind of something that showed up when we were doing lab tests or an ultrasound for something else. And it may be because what percentage of Americans have a little fatigue that they could report. And so it's kind of a non-specific, as we would call it, a non-specific finding. But we usually don't think about people having symptoms until they have the end of the spectrum liver disease, where there's been so much fibrotic scarring of the liver leading to the condition known as cirrhosis. And then you have all the things that show up, where you have like the yellow skin and the yellowing of the whites of your eyes, and the um, uh, big distended bellies from fluid accumulation, and red palms and little skin lesions. Like, that's at the way end of the spectrum where you've missed the boat. Everyone has when it gets to that end. And it's so good to see Dr. Brakey here. How you doing? Please feel free
All right,
to
great,
pipe on any and all of this.
Yes, please.
great. No, thank you for an excellent presentation. And I agree. It's like trying to kidney disease in city. It sneaks up without a lot of symptoms. So most of the patients I see with this have no idea. It's discovered on an ultrasound for some other purpose. But yeah, so we really need to raise awareness about this chronic concerning disease. Two questions for you all. You mentioned the importance of limiting sugars of all types. I've heard that high fructose corn syrup in particular may be especially challenging for the liver. Is that true, or what do you think?
I get to go first, and I'll give the harder part to Kiri. I'll get the low-hanging fruit, I guess. But what I had seen, and this was something that was presented by Hannah Kaliova from PCRM in a nice talk on related to fatty liver, was that sugars tended to lead to fatty liver more in situations of caloric excess. So when you're getting more than the amount of calories that you should per day from sugars, that's where it leads to the fatty liver. And that's a lot easier to do with, say, high fructose corn syrup than some of the other forms of it, I suppose. But and that was in contrast to fats, dietary, like saturated fat, where you didn't even have to have excess calories from saturated fat, and you were seeing more damage to your liver. Why high fructose corn syrup seems to be more associated with it? I don't know if it's a total just because of how much you get in these sugar sweetened beverages, or if it's something else. I don't know if anyone else knows.
It's a great question, and I should have done a deep dive on that, but I don't have the answer.
Okay, no, that's all right. I think it may be, as you say, just the prevalence of it in ultra processed foods and the amount. Like you say, it's so easy to drink it in a soda or to have it in a cake or donut. A second question, and you mentioned the importance of fiber. Thank you on all things. Do you think that a part of that is that our microbiome, of course, forms short chain fatty acids, which are anti-inflammatory and have so many benefits, and that these get first passed through the liver as well? Without a healthy microbiome, we may not be getting the advantage of the synergies between our community of microbes and ourselves. And I don't know how you think that more directly relates to the liver disease.
Yeah.
I go ahead, Dr. Pierce. Go ahead. Let you take that.
It came. So I think that's totally possible. And my guess is that it's, with the speed of how the microbiome research is going, maybe we'll get more information about it. But when I was doing research, definitely the microbiome came up. And is that how much of that is avoiding the sorts of foods that lead to an unhealthy microbiome, the saturated fats and the processed foods? How much of it is the benefits of the good bugs producing their byproducts? Yeah, almost certainly a synergy of that and other things that we don't understand. But yeah, I'm glad you bring it up. I'm not sure.
Yeah. Another part, I think, in his book, How Not to Age, Dr. Greger talks about the fact that animal proteins commonly do make it through into the colon and putrefy. These form toxic compounds, which then again first pass through the liver. So I think you're right. It's probably a combination of lack of beneficial effects from the healthy microbiome and the negative effects of the animal protein saturated fat, and environmental toxins that are 13 to 20 times more prevalent in animal foods due to biomagnification. Sorry, I'm answering my own question too. Go ahead.
No, it's all right.
Those are our favorite questions.
Yeah, that's good. And I think the point on toxins as well too is we allow like 13 or 1400 chemical additives to our foods that are not allowed in the EU. Like sprinkles that everybody likes on their cupcakes they're illegal in the UK. You can't put them on because of all the chemicals and the dyes that are in there. Like you literally cannot get them. And so like, what are we doing? Like, what are we doing to our bodies? Not just in addition to the foods and what the foods, like the animal products and all the hormones and chemicals and antibiotics that are in there that we're getting, or, the PFASs and PFOSs and the, heavy metals that, the fish, but just what we're doing to the foods in the processing, right? To make them taste good and hyper palatable, are really destructive.
Right. How many, I don't know if you, oh, go ahead.
Oh, I love that book. It's so good. Yes.
A new book called Ultra Processed People, and the tagline is the science behind food that isn't food. So yeah, you're right. We've just seen an epidemic now of foodborne illness, and it's it's more than ever. So thank you for being part of the solution.
I don't know if sorry. You guys recall how many thousands of substances in the diet are considered generally regarded as safe? The GRAS compounds. These are basically not really tested because they're probably safe based on they're related to something else that was safe. And when you see like these are in the thousands, I believe, it just makes you just want to eat, beans and rice and greens from scratch every day, and not anything with a label on it. Almost, it's
I think
amazing.
it's in the tens of thousands. It's a pretty high number.
Wow.
So Ganesh, I saw that you had a question here. What are the symptoms of fatty liver disease? Did that get answered to your satisfaction? Okay, good. All right. So back to the sugar topic a little bit. What about like date syrup, simple syrups? Would those contribute to high triglycerides as well?
They can, yes. Yes, they can. They say everything in moderation, but then what is moderation? Like there's no unit of measure, right? So one of the things that I have my patients do, especially those with metabolic syndrome, is wear a continuous glucose monitor, for 2 or 4 or 6 weeks or several months, and really keep a good log and a good food diary of what they're eating and what's raising, their blood sugar. And it's what is preventing it from coming down within 2 hours to the normal level, right? I think that's key. A lot of people are worried about, oh, my blood sugar went up, but it's what's happening to that blood sugar curve. Like how fast is it coming down? Is it coming down too fast? You become hypoglycemic. Is it coming down within 2 hours to normal? Or is it taking 3 to 4 hours to come down? And what was it that you ate, right? So sometimes I'll have them take a 1 hour postprandial, 2 hour postprandial, and we'll look at the curves together. I think for some, maple syrup is a little bit more of an insult to the body. People have a harder time with that. But anything that you're doing, again, those sugars are outside the cell wall, right? It's pure sugar. And there is, dates do have a little bit of fiber, but it's a little. And I'm not against dates, but, just a little bit can go a long way. And we need to learn, I'm really of the school that we need to learn to really readjust our taste buds, because everything in America is so sweet in the United States, right? Even some of some of the better, vegan foods, like you go for that vegan cookie or whatever, you can find some great recipes online using chickpeas and chickpea flour and, powdered peanut butter and oats, and everything is really good. But then if you're adding, because it's not as palatable to you, you're adding more date syrup or more maple syrup or more molasses or whatever it is to get that sweetness, you're sort of counteracting the benefit of, all those wonderful whole plant foods that are in there. So it definitely can be problematic.
Okay.
Yeah,
I don't know if that's I don't know if that's a great answer. I'm sorry.
I I agree with everything that Dr. Connor is saying. And though I don't think we're trying to scare you away from ever putting a little bit of maple syrup in that special dessert that you make every once in a while, or whatever it is that's your sweetener. I mean, it's we shouldn't. The vast majority of us don't need to worry about if I'm eating a totally unprocessed whole food plant-based diet and I'm putting in, a half a teaspoon of maple syrup or a whole teaspoon, right? We're comparing this to drinking 3 sodas a day, eating, a cheeseburger with fries and a sundae afterwards. And so know your numbers. Are you trying to stay healthy and you've got good cholesterol numbers? Or are you trying to avoid your third heart attack and your triglycerides are 300? There's a different prescription for both of those groups of people, just as a reminder.
And I think it's a great point that Dr. Pierce brought up, is know your numbers. Many times I see patients and they're not aware of what their numbers are, but they're very insistent on, I want to go down this pathway. And I say, well, it's good that you want to go down whatever pathway, but we need to know your numbers to know how much of a risk it's going to be for you, right? If you want to do program X, but it's not necessarily geared for somebody who has, familial hypercholesterolemia, you need to know that, right? So that we can maybe guide and tailor that path you want to go on. That might involve a little date syrup or a little bit of maple syrup, a little bit of sweetness. But it's really important to know and to embrace those numbers, and to know where you are, what your risk factors are, and where you need to get to prevent, a heart attack or a stroke.
Okay, couple questions here in the chat box. Does proper or improper food combining of whole food plants affect the liver, and is allowing the time of no eating of 4 to 5 hours between meals helpful for the liver to give it a break? So what the first part of the question is, does proper or improper food combining affect the liver? And the second part is allowing 4 to 5 hours between meals helpful?
I can take maybe the first one. The good, the idea that was talked about more a few decades ago of, well, you'll do okay if you're eating plants, if you combine this plant with that plant at the same time, and maybe in the same spoonful, or like, we don't have to eat. The good news is we don't have to combine different sorts of plant-based proteins in the same meal to be able to get complete protein and not to avoid developing some weird deficiency. The body has a great way of balancing the components of what we eat at different times. Just, I think all plant foods basically do have all the amino acids anyway, but just in different ratios. And so I never tell my patients, well, if you're going to eat beans, you have to eat corn at the same meal, or if you're going to eat chickpeas, you have to eat rice within the next 30 minutes or something like that. So combining foods, in that sense, I don't worry about if that was maybe the origin of the question. I think having a variety of plant-based foods is the answer in general. And happy to talk about the second one too, but I don't know if anyone else wants to.
Giving a break. That's the whole idea behind intermittent fasting or time restricted eating. Often those two can be conflated. So intermittent fasting is more like taking 24 hours, and whether you're doing that's, like 2 days of fasting and then 3 days of eating, or 5 days of eating and 2 days of fasting, or 24 hours once a week. That's typically a whole day without eating. Time restricted eating is where you limit yourself to, an 8 or a 10 hour window during the day. And matter of fact, Dr. Greger just had a video on this and a blog on this today on nutritionfacts.org, that eating your calories earlier in the day and giving yourself time before you begin eating the next day. So you have breakfast, lunch, and dinner. If you put that in an 8 or 9 hour window, and then give yourself, time until the next day, right? Give yourself a good 10, 12, 14 hours is even better. Some can do 16. It's a little bit, I found for me, it was a little bit harder, but give yourself a good 10, 12, 14 hours rest. Let that body rest. 12 or more is better. Can really have a positive impact on your triglycerides, on your cholesterol, on your weight, can make a big difference.
Yeah. So I don't think that I don't know of data that says if you eat and you wait 2 hours versus 4 hours, it's any easier on the liver. My guess is that there's not a major difference. We're usually thinking about a 12-hour minimum, and that's basically just done overnight into the morning, unless you're like a shift worker and it's flip-flopped or something.
Okay, let's take this one last question here. Are caffeinated drinks like coffee and tea, do those have an adverse impact on liver health?
Ooh.
The only one that I know of is unfiltered coffee can have an adverse effect on the liver. But I don't know anything specific on black coffee that's filtered or tea.
And what I think you were referring to, that one, is that you can sometimes see elevated blood cholesterol levels in people who are drinking mostly unfiltered coffee. So coffee like Turkish coffee or maybe French press coffee as compared to something that's through a paper press.
Right.
And some people have that problem, some people don't. So another reason just to, you're like, I always drink from a French press and my triglyceride value is 90 and my total cholesterol is 150. You're like, keep drinking from a French press. It's okay.
Mm-hmm.
But as far as I would just say that overall studies of coffee and of tea, green and black tea, are overwhelmingly positive for health, like avoidance of diabetes. And we know that diabetes is with insulin resistance is tied into liver health. And so I would say overall tea and coffee, it's great. Don't use that as a vehicle for, a half a cup of half and half. Try to drink them in a healthy way, but in general, it's good for you.
Great answers. Thank you. So how can people get in touch with you, or Anthony, could you explain how people can work with Doctors Kiri O'Connor and Dr. Jeff Pierce? How would they do that?
Sure thing, my pleasure. I just actually put 2 links in the meeting chat as well. I put the link to Dr. Kiri's bio page and to Dr. Jeff's bio page in there. Both of them see patients via telemedicine at Love Life Telehealth, and they're available to see patients in different states. You'll have to look on those pages that I put the links to see if they're available in the state that you're in, because the U.S. licensing requires that the doctor be licensed in the state where the patient is during the time of the appointment. So that's the one tricky part about telemedicine. If neither of them are available in your state, we do have other doctors. At Love Life Telehealth, we have doctors covering all 50 U.S. states. So everyone can have an appointment. It's just that you'll have to see, I believe Dr. Pierce is licensed in 2 states. 3 states, sorry. And Dr. O'Connor, I know you're licensed in quite a few more. I forget how many states that you're licensed
13.
in. 13 states.
Yeah, and if you don't live in one of those 13 states, it might be worth moving to it so that you can have Dr. O'Connor as your doctor. And the reason I think Anthony said 2 states is because a lot of people consider Texas its own country, but that's where I'm from. But Texas is one of my 3 states: Texas, California, and Florida. Yeah.
Well, and Ganesh is asking if Georgia is covered, and somebody at Love Life Telehealth would cover Georgia. I'm not sure if either of you do. Okay.
Yeah. But thank you for your interest. I would see any and all of the providers in our group for sure. Yeah.
Yeah, they're all wonderful.
And we consult and talk to one another all the time, if we have a complicated case, because our collective experience is better than any one of us individually. So we've got a really good working relationship amongst one another. It's a fantastic team.
Okay. So and what about Canada?
Yep, I'll get to that one. So I just checked. We do have 3 doctors available who can see patients in the state of Georgia. So you're in luck and you have your pick. And each of them, you can see their bio. If you go look at their page, you can also watch a short intro video, so you can get a little bit of a feel for kind of who they are, what their interests are, and things like that. For patients in Canada and anywhere else outside the United States, any of the doctors are available, but it's not for licensed medical care. It's for lifestyle medicine consultations. And what that means is they can certainly consult with you. They can review lab work that you have had done elsewhere. They can review your lifestyle. They can make lifestyle recommendations. They can do all of those things. The only things they cannot do is they cannot order lab tests, and they cannot prescribe medications if you're outside. So it's not considered medical care. At that point, it's considered a consultation. But I'm very proud to say that at Love Life Telehealth, patients have been seen in every single one of the 50 US states and 27 countries internationally. So I don't want to say it's a very common, but it's a relatively common thing for the doctors to do these lifestyle medicine consultations with people outside the country. And when they do need to see some lab results or something, they're usually working with the patient. Then the patient goes back and works with their provider in their home country, and they can get their lab work done. They can upload it to the patient portal. They can still go over it with their Love Life Telehealth doctor and do all of those things. So we work really hard to make sure that these guys are available for people everywhere.
So are patients in the US, are they offered consultations as well, or would it be more
No,
strictly
in the
medical care?
US, because
Mhm.
it's a physician, an MD or a DO,
Mhm.
there's no way to do a consultation with someone across state lines where the doctor's not licensed, because the
Okay.
US laws are going to look at it as, here you have a patient with an illness or a medical condition who's talking to a doctor. That's automatically considered medical care, and that has to be fully licensed in order for that to
Interesting.
happen. So they cannot do consultations with people in other US states. So all visits for for people in the US are fully licensed medical appointments. And they can do all of those things like order tests and prescribe medications and anything that you'd want any other doctor to do, with the exception of things that require physical examination. Obviously, they can't do that over telemedicine.
Thank you. That clears up my question. Very good. Well, this was a wonderful presentation. A reminder, the replay of this will be in the members portal. Be sure to watch the replay. I'm going to for sure. I was taking notes very quickly. If you have any questions about the webinar or anything else tonight, you can email connect@pbnsg.org. Or if you have questions about Love Life Telehealth, you can contact Anthony's group at any time, right? What would be the best email
Yep.
there, Anthony?
You can go to love.life/telehealth. I'm just putting it in the chat as well. And
Okay.
you can email us at telehealth@love.life, or we also have a phone number right on the website. You can literally pick up the phone and call, and you'll speak most likely with Susan, who works our phones with us. Sometimes you'll catch me, sometimes you'll catch Christy. We have a couple of people who answer, but any of us will be happy to answer all of your questions and help to get you, help to answer any questions you have, and also help you to get connected with the doctor who's really going to be able to help you.
All right. Any parting words of wisdom from any of you for our viewers as we part?
I would just put thank you very much for your attention and for being here, and I'll put in a plug for Dr. Kim Schoyer's talk that's coming up. She's great, docs, smart presenter and all that stuff. So I would recommend checking her out as well.
Agreed. Thank you for the opportunity, and eat your fiber. So fiber is
All
good.
right.
It's your friend. Fiber is your friend.
Yeah,
And
thanks so much
Dr.
for having us. It was wonderful to see everyone tonight.
Yeah, thank you very much. This was a great opportunity.
Okay, thanks everyone, and we hope to see you in the next. Dr. Kim will be here on February 29th. Be sure to sign in for that as well.
That's a rare one too, isn't it, Sid? We don't get too many February 29ths.
Right. Very good. And it's the last day of February, so she'll be talking about heart health, right? Heart Health Month.
Awesome.
Well, good night, everyone. And thanks so much to all of you who presented tonight. And for those of you for joining us, thank you so much. and we'll hope to see you soon.
Thanks for watching and for being a part of the PBNSG community. If you found this video helpful, be sure to give it a thumbs up and subscribe to our channel for even more plant-based insights, expert interviews, and delicious recipes.